Okay, this is section 2 of our series on medical terminology, and in this section we're going to go deeper into prefixes and suffixes. As a reminder, as a result of completing this series of videos, you're going to accomplish the objectives of being able to discuss the 4 parts of medical terms. You're going to be able to recognize word roots and combining forms, identify the most common prefixes and suffixes, describe the anatomical positions, define the body planes, identify regions of the body, define directional and positional terms, and then build, divide, spell, and pronounce common medical words. All right, so what is a prefix? Well, a prefix in a medical term is no different than a prefix in any other language. It is added to the beginning of a term. Some examples in the medical space are things like inter, relative to the location of an organ. So inter means between. A prefix can also relate to the number of parts, such as hemi or half. Or a prefix could relate to time or frequency, such as pre, which means before. So again, prefixes are typically related to the location of an organ, the number of parts, or the time or frequency. Here are some examples of prefixes and their definitions. There are many, many more of these that you're going to get exposed to in the other video sessions that I have lined up for you. Ab means away from. Ante means before or forward. Keep in mind here, ante is spelled A-N-T-E, not A-N-T-I. Brady means slow. Endo means within or inner. Hyper means above or beyond. Hypo means under or deficient. Infra means beneath or below. Inter means among or between. Macro is large. Micro is small. Peri is around. Post is after or behind. Pre is before or in front of. Retro means backward or behind. Sub means below or under. Super means above or excess. Tachy means fast. Trans is across or through. Ultra means beyond or excess. Now let's talk suffixes. So a suffix is attached to the end of a term. It adds meanings such as condition, disease, or procedure. So some examples are algia, which is pain, itis, which is inflammation. You'll remember before we said carditis, which is inflammation of the heart. So there's describing a disease. Or a procedure. Ectomy is a suffix that describes the removal of. All medical terms must have a suffix. It's the only mandatory word part other than, of course, the word root. Here are some examples of a suffix. We talked algia on the last slide. That means pain. Size means cut. Dynia means pain or swelling. Ectasis means dilation or dilatation, as you'll sometimes hear it pronounced. Itis means inflammation. Logi means study of. Lysis means destruction. Megali means enlargement or large. Oma means tumor. Osis means condition, usually an abnormal condition. Pathy means disease. Rhea means discharge or flow. Sclerosis means hardening. Stenosis means narrowing. Taxis means movement, and that's taxis, not taxis, taxis. Trophy is growth. Now, there can be a case where a suffix can be used to convert a word root into an adjective and a complete word. An adjective suffix typically means pertaining to. So the new word can then be used to modify another word. So let's give an example of an adjective suffix. To state that a patient has an ulcer in his stomach, we take the word root gaster, put the O on it. So gaster means stomach. Ick means pertaining to. So gastric means pertaining to the stomach. So a gastric ulcer is an ulcer found in the stomach. So that would be an example of where using the suffix and relating it to the word root to deal with a condition. And so their gastric pertains to the stomach. So a gastric ulcer found in the stomach. So some suffixes are used to refer to procedures, diagnoses, or surgeries. So here are some examples. Centesis is where you surgically remove fluid. So you do a surgical puncture to remove fluid. That's centesis. Ectomy, we mentioned earlier, is to cut out or surgically remove. Gram relates to recording or picture. You've heard the phrase mammogram, cardiogram. Those are recordings or pictures. Meter is a measuring device. Thermometer is just a different way to pronounce it. So you'll hear it pronounced meter or meter, depending upon the use. Ostomy is a surgical opening. Others are otomy, cutting into. Pexy is surgical fixation. Plasty is surgical reconstruction. Oriphy is suture. And scope is an instrument for viewing. So that's it for this particular session. We're going to continue and dive deeper into how you do word combinations in the next set.